Ayan. So, let's, wala pang sagot. Yes, wala pa talaga siyang sagot. Okay? So again, for those na hindi pa po nakakapag-take sa mga online exam natin, yes, sir, bakit may inuulit-ulit-ulit? Okay, kasi kailangan ninyong ulit-ulitin. Okay, para at least, may mga errors kasi na nandun na intentionally yung mga iba para at least nakikita ninyo. Okay? And luckily, nakikita nga naman. So very good. Okay, so again, so let's continue now with our last set of our pre-board exam. Okay, last set of our pre-board exam for your pre-board 1. So again, thank you for joining. Okay. So we are now live on Facebook. Okay. Check ko nga. Ang init ng panahon. Yeah. Keyboard. Good. So we have 8 participants who are now in Facebook ngayon. 53. Okay. Ayan. Basic. Ayan. Nakikita nyo na ba yung slide ko? Ay yung aking for your PHC pre-board. Nakikita nyo? Yes or no?
Yes, sir.
Okay, very good. Okay, so, ayan. At least nakikita nyo na. Okay, ay, nasa na yung iba? So, ayan. So, I think we could start now. Okay, so we are now live on Facebook account. So, after this, magkakaroon ulit tayo ng activity ha. Okay, so, ayan. So, anong number na tayo? But before we could start, of course, bago tayo mag-start mga bebe, paki-turn on yung mga cameras natin for our picture taking ceremony. Yan. Picture muna tayo mga bes. Para at least nakikita ang mga kagandahan po ninyo. Remove pin. Ayan. Okay, very good. Okay, paki-turn on yung mga cameras po natin. Hala. Okay. Baliktad yung camera nyo, Giovanni. Yeah. Oh. Cast. Umuwi kami, Miss Castro. Okay. Paki-turn on yung... hindi. Okay. Paki-turn on yung mga cameras natin. Ayan. Erpelo, sino kasama mo dyan? Nasaan si Jericho? Very good. Okay. Okay ka lang, Miss Perez, Angeline? Parang ano kayang ginawa ninyo? Okay, natatakot ako sa pormahang ganyan, bes. Itong mga pormahang ganyan, ano kayang ginawa natin? Charot lang. Oy, turn on yung cameras mo. Okay, pakiturn on yung mga cameras po ninyo. Bilis. Okay, so ayan. Sino kasama mo, Miss Belio? Okay. Leia, sino kasama mo dyan? Bakit may tao sa likod mo? May babae ba sa likod mo? Naka-pink. Okay, bilis. Bilis. Paki-turn on na yung mga cameras ninyo para sa picture taking natin. Hoy. Yan, Miss Pingolo. Yung mga panty girls natin, yung mga pink panty. Okay, paki-turn on yung mga cameras ninyo. Bilis. Imap. Ay, ikaw lang ah. Okay. Nasaan si birthday girl? Hazel Joy. Miss Palmes, nasaan ang birthday girl natin?
Nauwi ata sa kanila, sir.
Umuwi sa kanila. Ay, okay. Sige. Bakit may review kayo kanina?
Meron po sa Funda. Hindi ko kilala yung reviewer.
Okay. Bakit? Matanda ba? Hindi naman.
Taga ano daw yun? Pampanga ata daw. Hindi ko kilala.
Okay. Si Joel naman ang funda ninyo. Sa IMAP.
Oo, si Sir Joel nag-reinforcement pero parang si Ma'am din. Sa ano din siya.
Ay, nag-lecture si Ma'am G. Okay. Sige, sige. Paki-turn on na po yung mga cameras ninyo. Ang kukulit ng mga to eh. Bilis. Sa mga friends natin, madaming gustong mag-join para lang mag-picture taking tapos kayo ang hindi naman naka-turn on yung camera ninyo. Pagpapaluin ko kayo. Mark, paki-turn on. Rhea, Belio. Ano pa mga nandito? Miss Bayo. Okay. Kathleen. Gamboa. Hyacinth. Pa-check nga. O, yan. Okay lang, lovely. Basta naka-turn on yung camera mo. Okay, ayan. Nasa yung mga iba. Okay, very good. Paki-turn on. Brown out. Okay. So, sino pa yung mga nandito? Cherry. Nasaan ka na? Ay, Cherry, kailan ang balik mo? Hindi, pau-eat ko. Okay. Sige, sige. Uy, Emilio. Nasaan ka na? Miss Lee. Okay. Bilis. Look at the camera, mga midwives. Okay, ayan. Kayo muna. Kayo muna. Sa mga gustong mag-my day. Bilis. Habang nandito pa ako. 1, 2, 3. Sa mga magma-my day ha. Kung mag-my day, mga best. Okay? Sige. 1, 2, 3. Kayo naman. Okay. Okay. Look at the camera. Wait lang. Gusto ko kasi Wait lang. Kaya nga aalis. Magde-delete lang ako.
Okay. 32 gig.
Anong 32 gig? Okay. Itong camera ko itong cellphone ko 4 years na sa akin. Wala akong balak palitan. Don't worry. Okay, look at the camera. 1, 2, 3. Isa pa. Pa-cute naman mga best. Isa pa. One more. Tayo naman. Okay, look at the camera. 1, 2, 3. 1, 2, 3. Isa pa. 1, 2, 3. Last one. 1, 2. Okay. Sa mga Facebook Live, congratulations. Wala talaga kayong pwedeng mapicturean dyan. Hindi po pwede. Okay. Kahit anong gawin natin, hindi ko kayo pwedeng picturean dyan. Ang hirap. Okay. Hindi ko alam kung paano. Okay. So let's continue na with our ratio. Okay. Let's continue na po with our ratio. On your rationalization on our PHC. Okay. So alam nyo, yung evaluation ko dito, madali-madali lang to eh. Okay. Ang pinakamahirap so far sa mga pre-board ninyo was yung funda. Okay. Funda on some portions lang. Okay, but not all. Okay? So number 54, but then mga midwives, when you take the licensure examination, okay, ayokong nakakarinig na madali ang exam. Okay? Kung naka-smile kayo, ang ibig sabihin okay na 'yon sa akin. Basta wag niyo lang sasabihin na napakadali ng exam because it really hurts. Yes, ma'am? Okay. Okay, so going back. Okay, so maingay. Ano naman yun? Okay na. Okay, yan. So, sa board exam mga midwives, kahit madali yung exam, huwag yung sasabihin na madali. Okay? Nai-stress ako kapag nakakapagsabi kayo ng madali ang exam, ha? Ang gusto ko lang sabihin ninyo, mag-smile na lang kayo. Yung pinaka the best. Okay? Kung nakamisuot, it simply means na mahirap ang exam. Okay? Kapag naka-smile, ang ibig sabihin niyan, medyo okay na okay ang exam. Nakuha po ba? Okay? So, ang pinaka-importante sa akin, kailangan yung pumasa lahat. Kung meron mang mag-top na chair, it will be a bonus na po. Okay? So yun yung mga gagawin natin sa board exam po natin. Nakuha po ba? Okay. So basta ang importante po sa akin matuto kayo at kailangan ninyong pumasa sa board exam. Kung may mag-top notcher, bonus na yan sa akin. Okay. So do not worry during the board exam. Okay, tatanungin ko na sa inyo kung ano yung ibibigay ninyo sa akin. Okay, kasi meron nang nakapag-pledge sa akin. Okay, si Sunshine Gatingan from NLPSC. Ano ba ang sabi niya sa akin? Okay, kapag pumasa daw siya sa board exam, bibigyan daw ako ng isang kaban ng bigas. So imagine, that's around 20, ilang kilo ba yon? Ilang kilo yung isang kaban? Yung malaking kaban 1 kaban of rice. Okay? Hindi ko alam kung ilang kilo yun I think that is 50 kilos ba or 100 kilos? Okay? 50? Okay, 50 kilos yan yung pinakamalaki ba yan? Okay, yan. So 50 kilos kasi yung rice niya, yung may brown. Diba? Social. Okay? So, excited na ako dun actually. Okay, ikaw Miss Tiwati, anong bibigay mo? Kay Miss Donato, ina-expect ko ng iPad Pro Max. Okay? Kay Miss Tiwati, siguro mga tatlong kaban ng patatas. Okay na yun sa akin. Okay. Okay. Yan yung mga basta pag pumasa, okay? Ay, mag-e-expect ako ng LBC, ng JRS. Ayan, okay? So yung mga gagawin po natin mga midwives. Okay? So, let's proceed now with number 54. 54 ba? Okay? 54 ba tayo? Tama ba? Okay, number 54? Okay. So, try nating i-ratio lahat tonight. Okay? So, ano pa nga ba itong mga nandito? PGD, PHC, Preboard 1. Okay? So, ayan. Hi. Number. Anong number siya? Limutan ko na. 54. Oo nga, nasa kon. Okay, so 54. Okay, 54. Wait lang Okay, so number 54 po tayo. Okay, so it says here on number, wait lang. 54. Ayan, 54. Nasaan ka? Ayan. So based on, the WHO is concerned of the unnecessary deaths of children below 5 years old. That's why they develop your IMCI. Tama. Okay, the major objective of your IMCI is to reduce morbidity and mortality among children under 5 years of age. Okay? So, nagets niyo po. Under 5 years of age, okay, that's why nagbigay sila or develop nila yung inyong tinatawag na IMCI. Wherein, if you utilize your IMCI, you will become little doctors. Yan. Little doctors. Why is it that little doctors siya? Nagiging little doctor ka kasi via that, okay, via your IMCI, pwede kang magbigay daw ng antibiotics, okay, pwede kang mag-treat, okay, because with the use of your IMCI, all of your actions will be guided. Nakuha po ba? Okay, kasi stated na lahat ng gagawin mo. Example, meron kang chest and drawing. What is the classification for chest and drawing, mga midwives? What is the classification for chest and drawing? Chat box. Classification ng chest and drawing natin. Hoy, bilis! Ang tagal nyo sumagot. Ano yung classification ng ating chest and drawing? Very good. Okay, so ayan, kailangan yung sumagot lahat, mga midwives. Okay? I want to check kung talagang alam ninyo. What is the classification for your classification for your chest and drawing? Meron siyang chest and drawing. Anong classification niya? Okay, ayan. Very good. Madami pa rin ang mali. Okay. So kapag meron kang chest and drawing, okay, the classification will be pneumonia. Nakuha. Okay? So the classification would be pneumonia. Okay, yan yung bago na po na classification ng ating chest and drawing. So when we talk about chest and drawing, when the lower chest wall goes in, when you breathe in, the new classification now would be pneumonia. Nakuha. Prior to that one kasi naging severe pneumonia siya. Pero ngayon, ang isasagot sa board exam, pneumonia. Nakuha po ba? Okay, so when the lower chest wall goes in, when you breathe in, that's what they call your chest and drawing. Okay, that's what they call your chest and drawing. Nakuha. Okay, so yan yung tinatawag natin na chest in drawing ha. Okay, so ano? Oy, wait lang ha. May bisita na naman ako. Yes! Why? Oh, yes, you are beautiful. Can I have my class na? You're gonna dry your hands? Oh. Okay, pinakita sa akin ang kapapolish niyang nails. Okay, so going back. Okay, so 'di ba meron na siyang pneumonia? Okay. So meron na siyang pneumonia, pwede ka na bang magbigay ng antibiotic? Yes or no? Yes, because we have the so-called your first line antibiotic and your second line antibiotic. So therefore, it is already stated in your IMCI, okay? Paano ba 'yan? I don't know how. Okay? So you 3. Oh, no, let me put it.
Dry.
Okay, so go back there. Okay, so let's go back mga midwives. Okay, with the so-called your pneumonia, meron na tayong tinatawag natin na antibiotics. Ano yung antibiotic po natin? Your first line antibiotics with the use of your amoxicillin, wherein you have to give it for how long? To give it for how long? Ang ating antibiotic. How many days? How many days? Okay, papaluin ko na kayo lahat mga bebe. Okay, pakisulat po. Okay, take note ha. Amoxicillin pakisulat 5 days. Okay? So you have to give now your amoxicillin for 5 days. Then, okay, so you have to give now your amoxicillin for 5 days, but kailangan niyang mag-follow up after how many days? 3 days. Again mga midwives, okay? Again, pakisulat po, nagmamakaawa ako sa inyo. Okay, ilang araw magbibigay ng amoxicillin? Ilang araw magbibigay ng amoxicillin? 5 days. Okay? 5 days po yan. Kailan siya magpa-follow up? After 3 days. Bakit after 3 days? Because that's the time wherein ma-check natin kung effective yung kanyang amoxicillin o hindi. Walang pagbabago. Second line antibiotic. Nakuha po ba? Nagets nyo na mga midwives? Again. Okay, kapag may chest indrawing ka, what's the classification? Pneumonia. Okay, so I want you all to participate para mas mabilis tayo. Okay, so nagbibigay tayo ng pneumonia. Hala, walang plan B sa pneumonia. Okay, ano sa plan? Nasaan yung plan A, plan B, plan C? That is for your... Okay, para saan yung plan A, plan B, plan C? Saan siya? Okay, that is for your dehydration. Okay, that's for your dehydration. Nakuha mga midwives? Okay, going back ha. Okay, amoxicillin for 5 days and then return siya after 3 days. But, okay, ano naman yung fast indrawing? What's the classification for fast indrawing? Ano yung classification for fast indrawing? Fast indrawing, fast breathing. Okay, for fast breathing naman, ano yung classification niya? Sagot! Kung mali, okay lang. Okay. Ano yung classification natin kapag may fast breathing? Okay, very good. Pakisulat ulit sa mga mali po. Sa mga mali ang sagot, pakisulat. Okay, fast breathing. Ano yung classification for fast breathing is we have your pneumonia. Okay? Pneumonia. Pneumonia pa din po. Okay, so that is your pneumonia. Again, ano ang fast breathing? What's the classification? Fast breathing, what's the classification? Pneumonia. How about chest indrawing? What's the classification? Pneumonia pa din. Okay? So therefore, okay, paano kapag may stridor? Ano yung stridor natin? Stridor is what? Harsh noise when you breathe in. Okay. Harsh noise when you breathe in. Okay, pakisulat po. Stridor is during inhalation. Okay? During inhalation. Okay, so kapag nagkaroon dyan ng during inhalation, it simply means na meron siyang severe pneumonia. Pakisulat, okay? Severe pneumonia. Okay? Severe pneumonia. Okay, so going back ha, kapag severe pneumonia, it simply means that you have to refer. Ano ang color ulit kapag severe pneumonia siya? Ano yung color natin? Okay, then do that. Okay, so we have your pink. So anong gagawin mo kapag pink classification ng mga midwives? You have to what? You have to refer. Okay? So you have to refer. Nakuha po ba? Okay? So you have to refer. Okay? I-refer na po natin yan. Bakit kailangan mong i-refer mga midwives? Okay? Kasi nagiging severe classification na siya. So kapag severe classification na po, anong ibig sabihin yan? It needs an urgent treatment. Kailangan na ng urgent referral. Nakuha po ba? But on your referral, you have to give now your first line antibiotic. antibiotic. What is your first line antibiotic again, mga midwives? Okay, so give the first dose of appropriate antibiotic. Okay, give the first dose of appropriate antibiotic. So, ano yung classification na tinitignan natin? So Rina, okay, ilang months si Rina? 11 months. Okay, what else? Meron siyang cough for 1 week. Okay. Sir, paano kapag cough for 2 weeks? What will I suspect? Very good. Kapag cough for 2 weeks, suspect for possible TB or asthma. Okay. So meron siyang coryza, reddish posterior palate. Okay. Tapos meron siyang 37.6. So meron siyang nagging cough and fast breathing. So meron siyang nagging cough and fast breathing. So therefore, based on Rina's classification, you plan to take which of the following action first? Okay? So ano yung unang gagawin natin dito? Okay, so number 54. Ano ang sagot for number 54, mga midwives? Okay? So ano yung classification niya? Meron siyang fast breathing. So what's your classification? Ano yung classification po natin? Is we have your... Ano yung classification ni Rina? Meron siyang pneumonia. Okay, aside from pneumonia, ano pa rin meron sa kanya? Okay, meron siyang cough for 1 week, meron siyang irritability and episodes of vomiting, meron din siyang coryza. So what will you suspect if you have coryza? Ano yung isususpect ninyo, mga midwives, kapag meron kang coryza? Very good. So meron siyang measles. Again, going back into your measles, mga bebe, what is the incubation period of measles? What is the incubation period of measles? Is your 14 days, or that is equivalent to 7 to 21 days. Okay, meron siyang 7 to 21 days. Okay, 7 to 21 days, or the average would be your 14 days. Nakuha po ba? Okay, so that's your measles, ha? So take note on your measles, okay? So what is your classification? Are you going to refer, Elena? No. Okay, do not refer. Bakit may re-refer? Nakuha? Okay, so refer Elena to the nearest hospital. So ano ang gagawin natin? Meron siyang pneumonia. So you have to give the first dose of appropriate antibiotic. So you can give now the first dose of appropriate antibiotic. Nakuha. Okay, so ano ang meron pa sa kanya? Okay, so kung titignan nyo, meron siyang coryza. Tama ba? Okay, meron siyang coryza. Okay, sir, how about yung episodes po niya ng vomiting? I-assess po ba natin? Okay, good question, Bebe. So meron na siyang classification. So meaning na-assess na po siya. Nakuha po ba? Meron na siyang assessment. So meaning tapos ka na sa assessment, tapos mo na siyang ma-classify. Nagets nyo? Okay, so tapos na siya, ha. Tapos na yung assessment. Nandito na nga yung assessment natin, eh. Meron na siyang cough for 1 week, meron na siyang irritability, episodes of vomiting, meron din siyang coryza, okay, meron din siyang temperature. Also meaning na-assess na po siya at meron na siyang classification. So what's the possible classification? Meron siyang pneumonia, that's the time you can give now the first dose of appropriate antibiotic. Nagets po. Okay? Nagets yun ng mga midwives. Okay? So meron na kasi siya. Tapos na yung assessment natin. Okay? So next is we have also, she may present with fast breathing if her respiration is what? Okay, so balikan po natin, parang part na yun ata, ha. Okay, nandito ba siya? Ay, okay, wala. Okay, so let's go now in your fast breathing because fast breathing signifies what? Okay, fast breathing signifies, what is the classification? Anong classification? We have your pneumonia. Again, so we have your 60, 50, and 40. Okay, kapag 60 mga bebe, this is for under 2 months of age. Okay, so kapag under 2 months of age, ano yung meron sa kanya? Very severe disease. Meron siyang very severe disease. So therefore, what are you going to do? Refer. Okay? So you have to refer it. How about this one? Okay, on your 50 is we have your 2 to 12 months. Okay? So kapag 2 to 12 months, anong meron sa kanya? Meron siyang tinatawag natin na fast breathing. Okay? So fast breathing, give the first dose of appropriate antibiotic. This one naman is we have your 12 to 59. Okay? So we have your 12 to 59. Okay, para mas maganda, 2 to 11 months na lang. Okay, so 12 to 59 months, what's your classification? Still, that's what they call your fast breathing. So what are you going to do? You have to treat it at RHU. Nakuha. Okay, she may be present with fast breathing if her respiration is what? Okay, ilang months ba siya? 11. So therefore, pasok siya dito. Okay, so what will your answer be? Okay, if there is 50 breaths per minute. Nakuha? Kapag meron siyang 50 breaths per minute, it signifies na meron siyang fast breathing. Because your fast breathing signifies pneumonia. Nakuha po ba mga be? Okay, so meron bang nakalagay na RR dyan? Wala din eh. Okay, so nag-gets yun na po. Okay, so take note that is your 2 to 11 months. Again, mga midwives. Eh paano kapag 8 months old tapos 63? Fast breathing or normal? Ulit. 8 months tapos 63. Fast breathing or normal? Okay, fast breathing. Nakuha po ba? Okay, kaya nga kapag may mga kamag-anak kayo, okay? May mga kamag-anak kayo diyan. Ang i-check nyo kapag nagkakaroon siya na ng cough, you have to check now kung ilan yung RR nila in 1 full minute. Okay, I repeat. You have to check now their RR for 1 full minute. Okay? 1 full minute. Nakuha. What is the classification again kapag may fast breathing? Kapag may fast breathing, meron siyang tinatawag natin na pneumonia. Okay, so we have the so-called your pneumonia. Nagets po ba mga midwives? Okay, so please take note ha about your fast breathing. And fast breathing signifies na meron siyang pneumonia. Okay, so fast breathing signifies pneumonia. Nagets po ba mga bes? Okay, so when it comes to your pneumonia, it's a bacterial infection. Nakuha? So when you talk about your pneumonia, that is a bacterial infection. Okay? So we have also your viral pneumonia, but then dominantly, sino? We have your bacterial infection. Next po natin mga midwives, number? Okay, so number 56. According to World Health Organization, the most common cause of death among children is we have your pneumonia. Okay, that's your pneumonia. That's the most common cause of death among children who are under 5 years of age. Okay? Next, BCG immunization is against for what? So para saan po? That's against now your tuberculosis. Okay, take note ha. In your BCG, we have your Bacillus calmette-guerin. So bakit Bacillus yan? Okay, so we have your Bacillus calmette-guerin. So bakit Bacillus yan? Because we're referring now to the shape of the what? Of the mycobacterium. Okay, so ano siya? Bacillus pa. Okay, so take note ha. Ang lactyo, ano yung lactyo? What is the drug? Okay, what do you call now the antibiotic against your lactyo? Okay, so ano yung para sa lactyo na po natin is we have your tetanus. Okay, how about your measles, MMR? Yung bago na natin for DPT, pentavalent. Okay, so BCG immunization is against for TB. So what is the site of BCG immunization for school entrance? School entrance naman. Okay, so kapag school entrance mga bebe, saan ba? Is we have your left deltoid. Okay, so we have your left deltoid. Okay, pero hindi ibig sabihin, sir, on my first na injection ng aking Hepa B, ay ng aking BCG, wala naman siyang permanent scarring. Okay? So kapag walang permanent scarring mga bebe, will it means na hindi effective yung kanyang BCG vaccination? Yes or no? Walang scar. Okay, shall I repeat? Okay, uulitin ko ba yung pagbabakuna? Yes or no? Yes or no mga midwives? Okay, very good. No po. Okay. Bakit no? Okay, kasi kapag ginawa mo yan, okay, magiging double dosage ka na. So that's for, okay, kahit wala yung permanent scar, as long as you have a record na bigyan ka ng BCG nung ikaw ay bata pa, it simply means that it's okay. Proceed now with your school entrance. Nakuha po? Because the scar is not an indication for the effectiveness of your BCG vaccine. Okay? So that is not, okay, that is not the baseline data for you to say na ganun po. Next, what vaccine is usually administered by the midwife in your intradermal route? Is we have your MMR. Okay? Pag wala kang nakitang measles vaccine, you can answer MMR. Okay? So we have the so-called your MMR. Again, okay, balikan po natin ha. Nagbigay ako ng tetanus toxoid kay mother. How many persons? Okay, ano yung protection na binibigay ko naman sa baby? So it will last for how long? Okay, it will last for how long? Okay, it will last for how long? Few months. Okay, few months po. Okay, so nagbigay ka ng tetanus toxoid immunization via IM. Okay, so what will happen? It will give protection sa baby by about few months lang. Okay, so bakit few months mga bebe? Okay, bakit few months? Bakit few months? Kasi few months lang, kasi nagbibigay tayo ng tinatawag natin na natural passive immunity. Okay? So, natural passive immunity. Nakuha. Okay? Natural passive immunity. Very good. Okay, itong mga to. Active pa ang aking mga bebe labs. Okay, so the answer is BCG, hindi po ang measles. Okay? Nakuha po ba? Okay, so ano ulit yung measles natin mga beshi? Measles is your subcutaneous together with your MMR. Nakuha? Okay, next. Okay, so excited much kayo ah. Okay, na-stress ata yung mga 99 sa sagot na BC na measles. Okay, so take note. Okay, a 2-month-old infant is brought to the clinic for the first immunization against pneumonia. Okay, so the midwife should administer the PCV via what route? Okay, so on your pneumococcal conjugate vaccine, binibigay yan via what? It is given via IM. Okay, so kapag PCV mga midwives, okay, your PCV, okay, PCV is intramuscular. Okay, so intramuscular. PCV, pneumococcal conjugate vaccine. Okay, that's what they call your pneumococcal conjugate vaccine. So again, for PCV, okay, PCV, what is the route for your PCV? Again, ano yung route natin for PCG? PCV, sorry. Okay, so take note ha, it is via your IM. Okay? So via IM po siya. Via IM. Saan usually nilalagay yan? Bastos lateralis. Nakuha. A 2-month-old infant, so therefore that is your intramuscular. Ano ulit yung IM natin? Intramuscular. Okay, so how about your oral? Ano yung mga oral po natin? The midwife should administer PCV via what route? Ano yung mga oral vaccines po natin? Is your ano yung mga oral vaccines po natin? Oral polio vaccine. How about your DPT? Ano si DPT? IM. Okay, so have your IM. How about your hepatitis B? IM pa din po. Very good. So what's your answer? IM. Okay. So PCV, what is PCV again? That's your pneumococcal conjugate vaccine. Okay? That's your pneumococcal conjugate vaccine. So saan nilalagay yan? Bastos lateralis. Okay. These vaccines are given 3 doses at a 1-month interval. Okay. DPT, ilang doses yan? 3. BCG, 1. Tetanus toxoid, 5. Nakuha. Okay. So what's the best answer? Oh, Alin Jim Jiao. Okay. So what's your answer? 3 doses. Measles, wrong. Oral po. Okay. So what's your answer? Oral polio vaccine, Hepa B, and DPT. So letter D is the correct answer. Okay, so we have your letter D is the correct answer. But, hindi lang, okay, tetanus toxoid. How many doses for your tetanus toxoid? Is we have your 5. Okay, so we have your 5. So what's your answer on number 61? The answer is letter D. Oral polio vaccine, Hepa B, together with your DPT. Okay. 62. Which of the following diagnostic test is definitive for tuberculosis? Okay? So anong ibig sabihin yan? It defines na talagang meron kang tuberculosis. What is your answer? By the way guys, your Mantox test together with your tuberculin test, they are the same. Nakuha? Mantox test together with your tuberculin test, wherein it is read between how many hours? How many hours po? Okay, how many hours for your Mantox test? Between, take note ha, it should be between 48 to 72 hours or between 2 to 3 days. Because after 3 days, okay, kapag wala pa rin yan, okay, kapag in-interpret mo yan after 3 days, hindi na siya pwede. So it is stated there that you have to perform it 48 to 72 hours. You have to interpret it. Nakuha? So what's the best answer? Definitive of your tuberculosis would be the presence of your antibiotic known as your, that can be seen under sputum culture. Okay? Sputum culture. Sir, in the sputum culture, wala pong sputum culture. What will I answer? AFB smear. AFB smear. Okay? So which of the following drugs can cause patients to develop pruritus? Okay? Pruritus and orange discoloration of the urine. Is you have your rifampicin. Okay? Balikan natin ang rifampicin mga mebe. Kapag rifampicin, nagkakaroon ka ng discoloration, di ba? Okay, discoloration. Nagiging orange-red po siya. Okay? Nagiging orange-red po kapag yan. Okay? Next, any question? Orange-red discoloration if you are taking now your rifampicin. Okay? If you are taking now your rifampicin, okay, orange-red discoloration. Nakuha po ba? Okay, ano number na? Next. So we have your, ano to? 3-drug combination and a blister pack for the treatment of your tuberculosis. So ano nga ba? Is we have your RIP. Ri. Okay, so ano yung ri? Rifampicin, isoniazid, and your ethambutol. Okay? Rifampicin, isoniazid, and your ethambutol. Nakuha po ba? Okay, so we have your RIE. We have your ri. Okay, ripe, ri. So take note, we have your RIE. So ano yung RIE? Rifampicin, isoniazid, together with your ethambutol. Okay? So we have your ethambutol. So ano to? These are the 3-drug fixed combination for the treatment of tuberculosis. Okay? That's for the treatment of your tuberculosis. Nakuha po ba? Okay, so do you have any questions mga midwives? Wala na. Okay, when the residents obtain water from a stand post to the neighborhood, what is your answer? 1, 2, 3, or 4? Stand post po siya. Okay, stand post is web your level 2. Okay, level 2. A water supply facility with the source of reservoir pipe distribution. Okay, so what's your answer? Household service is generally suited for densely populated. So ano siya? Level 1, level 2, or level 3? Okay, water supply facility with the source. Okay, so what's your answer? The answer po is we have your level 1. Okay, so we have your level 1. Tama ba ako? Yes or no? No. Ano po siya? That is what they call your level 2. Okay, so level 2 water supply. Okay, so we have your level 2 water supply. 68. A water supply facility composed by a source, a reservoir, a pipe distribution network. Okay, pipe distribution network with adequate. Okay, so what's your answer? A, B, C, or D? Okay, so we have your, mayroon siyang pipe distribution. So ang tawag natin dito would be your level 3. Okay, this one, when residents obtain water from stand post. Ano ulit yung stand post po natin? Okay, so ano ulit yung stand post po natin mga bebe? Okay, so ano ulit yung stand post natin? Okay, so kapag stand post, ano siya? Level 1, level 2, or level 3? Very good. Okay, so stand post po natin is we have your level 2. Okay, so level 2, which is your communal faucet. Okay, so again. So number 60, when residents obtain water from stand post, that is level 2. Okay. Level 2. Okay, ito naman, outlet but without a distribution system, generally adapted for rural areas where the houses are thinly scattered. Okay, protected well or a developed spring, anong level siya? Protected well. Hoy, ano yung protected well po natin? Okay, so when we refer to your protected well, okay, example yan of your level 1. Okay, example po siya of your level 1. Nakuha po ba? Okay, ulitin ko ha. Ulit natin mga bebe. When the residents obtained water from a stand post, that is your level 2. Pero kapag meron siya sa protected well, that is level 1. Okay? Level 1. Okay, a reservoir, a water supply. So what's your answer on number 67 naman? Distribution system. Level 1, level 2, or level 3? Without looking into the answer. Ano ang sagot? Ano ang sagot for number 67? A water supply facility with a source, a reservoir, a pipe distribution network with adequate treatment facility and household taps. Service is generally under the level 3. Okay? Level 3 po yan. Bakit po sinagot ang D kanina? Or naghanap lang ako? Okay? Yan. Okay? So 68 mga midwives. Okay? So 68 po natin. So meron siyang reservoir. Okay, so distribution network, so level 3 po siya. Okay, so we have your level 3. Nakuha. So what is our mnemonic here? Okay? Hindi, what's our key factor? Bakit tayo nag-level 3? Bakit tayo nag-level 3? Because of a pipe distribution network. Meron pa siyang treatment facility. Nakuha? So 69. Okay, 69 mga midwives. A 5-month-old was brought to this physician with a 3-day history of fever. Meron din siyang malay. Meron din siyang conjunctivitis at meron din siyang runny nose and cough. He had a maculopapular rash. Okay, so maculopapular rash is an indicative of your rubiola. Okay, starting his place and moving downward to his trunk. The family had visited Disneyland about 2 weeks earlier. On physical exam, the child has a temperature of 103 degrees Fahrenheit and the baby is coughing. So what is your most likely diagnosis? Oh, ano yung possible na diagnosis po natin dyan? Oh, what's your answer? What is most likely your diagnosis, mga bebe? Rubiola. Okay? Sir, bakit rubiola siya? Maculopapular rash. Kung maculopapulovesicular rash, okay, so yan, hindi po siya. Okay, so that's what they call your rubiola. So downward to his trunk wherein it will be more uncovered areas. Okay? So again, what are the 3 C's when it comes to measles? Ano yung tatlong C natin when it comes to measles? Sagot! Oh. What are the 3 C's? We have your conjunctivitis, we have also your coryza, together with your cough. Okay? So those are the 3 C's. Okay? Those are the 3 C's. Oh, okay. So we have also your 3 C's, mga bebe. Okay? So yun yung mga 3 C's po natin, ha? Wag na wag ninyong kakalimutan, conjunctivitis, coryza, together with the presence of your cough. Okay? So the presence now of your cough. Nakuha. Okay, so next po natin. So what is your answer? Oh, the most likely diagnosis would be your rubiola. Saan natin kaya nga hindi ko kayo pinapasagot agad-agad, pinapatransfer sa answer sheet kasi the following question pertains now into the previous question. Example, complex spot yung sinasabi na dito. Eh ang problema, hindi nga nagsabi dito kung meron siyang rubiola. So therefore, if indicative po na may cough na yan, ang ibig sabihin yan is what? Okay? Hayaan. Ay sorry, kapag meron na siyang complex spot, it signifies na meron na siyang rubiola. Okay? So we have your complex spots are seen in your measles. Okay? So next, among which of the following is a reservoir of measles virus? Okay. So saan na nagagaling yung mga measles virus po natin? Of course, sino po ang mga carrier ng mga measles po natin? Okay, so what's your answer? The answer is where we have your human beings. Okay, so we have your human. Okay, next, the mode of transmission of measles virus. What's your answer? Okay, so going back into your measles, mga bebes, we have your nasal and throat discharges. Nasal and throat discharges. Okay, so nasal and throat discharges are primarily A, B, C, or D. Oh, ano ang sagot? A, B, C, or D? Okay, nakopya nyo na po ba? Yes or no? Ano mga kopya natin dyan? Wala namang kokopyahin, sir. Kau naman. Okay, so what's your answer? We have your throat secretions. We have your throat secretions. Okay, very good. Okay, 73, 73, 73. Okay, so throat and nasal secretions po siya, ha? Okay, kasi when it comes to your rubiola or your measles, we have your throat. Okay, nasal and throat discharges. Okay, so after the 3rd stage of labor, the protocol would be to give oxytocin 10 units to the mother. Yan. So which assessment findings would indicate that this drug has produced and desired therapeutic effect? So kailan mo nasasabi yan? If nagkakaroon na po siya ng what? Okay? So decreased local flow is wrong. Okay? So ano dito? So we have your sustained uterine contractions or rhythmic yung kanyang uterine contractions. So that is for your oxytocin, ha? So oxytocin, which assessment findings would indicate that this drug has produced the desired therapeutic effect? So what's your answer? Bakit nga ba tayo nagbibigay ng oxytocin? Bakit nga ba? That is for you to have a sustained uterine contraction. Para masustain mo yung uterine contraction, so therefore, hindi ka magkakaroon ng dugo. Nakuha po ba? Okay? Yes, to contract pareho sila. Your rhythmic uterine contraction is usually given now. Okay, bakit nagkakailangan mo ng rhythmic uterine contraction? It happens now to induce your labor or to augment your labor. Nakuha. Okay, so which of the following is correct statement about the iron? Okay, on your iron content, ilan yung iron po natin when it comes to your iron supplementation is 60 milligram and 400. Okay, so have your 60 milligram and kailangan mo ding magbigay ng 6. Okay, take note 60 milligram and 400 microgram. Okay, and 400 microgram oleic acid a day for how many months? 6 months. Imagine, ang haba-haba mga best. Okay, so the answer is we have your letter B. Okay, next. A client with TB has been treated before with anti-TB. So ano yung magiging classification mo? Okay, so meaning bumalik siya. Na-treat na siya dati sa TB and then all of a sudden nagka-TB ulit. So, ano ang gagawin natin? Okay. So, what is your answer? A, B, C, or D? However, okay, so nagkakaroon siya ng treatment failure or meron siyang relapse. Okay, so meron siyang treatment failure and we have also your relapse. So what category is that? Category 2. Okay, so we have your category 2. 76. National Tuberculosis Control Program is to reduce the TB burden by decreasing the number of TB deaths. Okay, so number 76. Okay, so we have your 7,000. From 14,000 to 17,000 or 50%. Alam ko na lang kung di mo pa nakuha ito, pagpapaluin na kita. Okay, so nakuha po ba? Okay, so we have number 77. Okay, 77. 50% nandun na nga. Gawin mong 50% yung 14. And then what's the answer? 7,000. Okay, next. The diagnosis of your TB management patients with the disease and public health control service relies on accurate and timely laboratory tests. How to collect sputum examination for culture examination. Okay, so alin din daw yung tama po dyan. Okay, so first thing you're going to do, inhale and hold the air for a few seconds, exhale out slowly, inhale again, cough hard, sputum comes up into your mouth. Okay, so what's your answer? Letter A is the correct answer. Okay, so we have your letter A. Ayan. Okay. So, 78. Among which of the following is a contraindication of BCG vaccination? Alin dyan yung contraindication if you have HIV/AIDS? Okay, so have your HIV/AIDS. Nakuha po ba? So that's what they call your HIV/AIDS. Next, the recommended treatment for TB embodied by the national, okay, among which of the following is a contraindication for BCG vaccination? Ano ang contraindication po natin for BCG vaccination? That's your HIV/AIDS. Bakit bawal yan? BCG vaccination, mga midwives, is what? It's a live vaccine. Di ba sinabi ko? Contraindicated ang mga live vaccines kapag ganun. Nakuha. Okay? So, anong number na tayo? 79. Okay? So, we have your short course chemotherapy. So, short course chemotherapy, but then prior to your short course chemotherapy, anong tawag natin dyan? Okay, di ba dati short course chemotherapy or your SCC siya? Ngayon, hindi na po SCC ang tawag natin. Meron na tayong directly observed treatment, short course. Okay? So, we have your so-called your directly observed treatment short course, wherein it is internationally recommended a strategy in reducing the TB, cases. Okay? So in reducing the TB cases, we are utilizing now your dots. Your dots. Nakuha. Ng dots po natin. Okay, how about for leprosy? Ano naman yung leprosy po natin? Leprosy is for what? MDT. Okay? Your multi-drug therapy. Nakuha po ba? Again. Hypoaesthetic, hypopigmented. Anong tawag natin sa sakit na yan? Hypopigmented, hypoaesthetic. What will you suspect? Suspect for? Bilis. Suspect for leprosy. How about kapag nagkaroon ka ng maculopapular rash? Okay? Tapos meron ka pang vesicular rash. Maculopapular-vesicular rash. What will you suspect? Rubella. Okay, again, what is rubella? That's what they call your German measles. Okay? That's what they call your German measles. Nakuha po ba? Eltor. Ano ang isususpect natin kapag Eltor? Sagot! Cholera. How about enteric fever? Enteric fever. Cholera. Okay. So, cholera ba yan? No. Ano po yan? Ang kapag enteric fever is we have your typhoid. Okay? So, we have your typhoid. Maculopapulo-vesicular rash. Ano yan? Ano ba si maculopapulo-vesicular rash, mga bebe? That is what they call your chicken pox. Hoy, balikan natin ha. Maculopapulo-vesicular rash is for chicken pox. Nakuha? Kapag maculopapular rash, that is for measles. Okay? So ulit, maculopapular rash, that is for measles. Maculopapulo-vesicular rash, that is for chicken pox. Okay? Chicken pox. Maculopapulo-vesicular, chicken pox. Maculopapular rash, measles. Nagets nyo na mga bes? Okay, ulit. Ano ulit yung rubella? Ano yung rubella natin mga bebe? What is your rubella? Rubella is we have your German measles. Okay? So meron tayong tinatawag natin German measles. Ano yung meron kay German measles is we have your Forshamer's rash. Okay? So we have the so-called your Forshamer's rash. Okay? Kapag Forshamer's rash, that is for, sino yan? Okay, so we have your German measles. Maculopapulo-vesicular rash. Ano si maculopapulo-vesicular rash? Chicken pox. Paano naman kapag maculopapular rash? Maculopapular rash is we have your rubiola. Okay, paano kapag lockjaw? Lockjaw. Very good. That's your tetanus. Pseudomembrane. Pseudomembrane. Okay, diphtheria. Eltor. Cholera. Okay. Cholera. Typhoid fever. Enteric fever. Very good. Okay, so let's continue now. Okay, so ayan. Okay, so in a PTB case finding, sputum collection per sputum is how many times? Okay, every what? So PTBC ha, case finding po tayo. Okay, so the so-called your case finding. Okay, so sputum collection for a sputum smear examination is done by the midwife every month. Okay, so every month po siya. Okay, so what's your answer na every month? Meron namang 3 times a month. Okay, meron pang 6 times a month. So what is your answer? Okay, so wait lang ha. I-update ko lang to ha. I-update ko lang to. Okay, so utang ko muna yan. I-update ko to. Kasi parang incorrect yung data natin dito eh. Okay? 81. Among which specimen must be collected early in the morning? Anong sagot? Early in the morning. Yes, we have your sputum exam. Nakuha po ba? Sputum po. First specimen, second specimen, or third specimen siya. Okay? So, uulitin ko ha. Oh, makinig mga bebe. Okay. So take note, the moment na nagsabi yan, okay, the moment na meron siyang cough, okay, meron kang suspect na TB po, okay, suspected na TB, okay, suspected na TB po siya, ano ang gagawin natin? So, kailan? Yung first na pagkuha po natin would be at the health center. Okay, yung second po na collection natin would be what? Early in the morning. Okay? And your third naman po is kailan? Health center ulit. Kaya nga tatlo eh. Health center, okay? Early in the morning, health center. So, among which be collected early in the morning, that would be the second specimen. Okay? So, that would be your second specimen. Nakuha po ba? Second specimen. Pakisulat. Okay, first collection saan? Ano yung first collection natin? Saan? First collection natin would be your RHU. Okay? Bakit mga midwives? Okay, the moment na meron na siya, anong gagawin mo? Okay, the moment na meron kang sinususpect na TB, tapos meron siyang productive cough, kumuha ka na agad. Okay? And then yung second BC, okay, second naman would be early in the morning. And your third would be at the health center. Nakuha po ba? Okay, ulit mga bebe. First collection, saan? Health center. Second collection, early in the morning. Okay, third collection, that is your health center. Nakuha po ba? But if the board will ask you, what is the best time? When is the best time to collect specimen? That would be early in the morning. So ano yung magiging instruction natin? Okay, if you're going to collect those specimen, you have to ask the patient to take a deep breath. Okay, ilang deep breaths yan? Tatlo. 1, 2, 3. And then later on, ilalagay natin sa sterile container. It became Coco Crunch. Nagets niyo po. Okay? So that would be early in the morning. Okay? Next, the National Tuberculosis Control Program is one of the public health programs being managed and coordinated by DOH. So, implemented. So, kailan siya na-implement? Into 1996. Okay, so what do you call the strategy of NTP implemented in 1996? The DOTS. Nakuha po ba? That's your DOTS. Kasi dati-rate, tawag natin sa kanya would be your SCC, short course chemotherapy. Nakuha po ba? So, DOH, ano ba to? The DOH is committed to achieve the MDG. Kailan natin i-achieve ang MDG? What year? Okay, MDG kailan? 2015. How about SDG? Kailan naman yung SDG natin? Very good. How many SDGs do we have? Ilan ang SDG natin? 17. Ilan ang MDG? Ilan ang MDG? Okay, so we have 8 Millennium Development Goals. Okay, so take note ha. Kapag SDG mga midwives, okay, kapag SDG, okay, SDG that is 2030. While for MDG, kailan naman? 2015. Hindi natin na-achieve ang 2015 kaya meron na tayong bago. That's your SDG. So which of the following tetanus dose can give protection to a mother? Okay, so what's your answer? Mali kasi itong tanong. Okay, mali ang tanong dito. Dapat ang tanong dito is at least how many doses of TT, okay, that the mother must receive for it to become protected from tetanus. Okay? Kasi kapag ito ang tanong, which of the following tetanus toxoids can give protection to a mother? Of course, TT2, TT3, and TT4. Yan. Nakuha po ba? So, kung i-replace natin ang number 83, okay, at least how many doses of tetanus toxoid or at what dose of tetanus toxoid will give now protection to the mother? Nakuha? So the answer here would be TT2 if that's the question. Pero alam ko naman na nakuha niyong TT2 eh. Bakit? Because if you receive 2 doses of your tetanus toxoid, you will become protected from tetanus. Nakuha. Okay, ilan? Okay, ano yung protection na binibigay natin ng baby? Few weeks, few months, few years. What's your answer? If you give tetanus toxoid, kapag nagbigay ka ng tetanus toxoid ka mother, okay, so ilan yung bibigyan natin protection kay baby? 4 months. Okay, 4 months lang. For few months. Okay, hindi po, wala kasi hindi siyang specific. Okay, nare-recall ko na. Kasi sa board exam ang nakalagay few days, few weeks, few months. So what will you answer? Few months. Okay, nakuha po ba? 84 mga midwives. Okay, 84. One of your clinic days, 5 mothers who had their prenatal checkup have failed conjunctiva. Okay, so ano ang micronutrients sa kailangan natin? That would be what? Okay, meron siyang pale na conjunctiva. So, anong kailangan mo? Okay, very good. This will be your vitamin A. Okay? Vitamin A. Okay. So, tama ba ang vitamin A, mga bebe? Tama ba ang vitamin A? Wrong. Okay. Kasi kapag nagpe-fail ang conjunctiva, anong ibig sabihin dyan? Okay? Meron siyang anemia. Bakit yung sinabi ang vitamin A? Very good. Okay, so one of your clinics. So what's your answer? It's your ferrous sulfate. Okay, the answer is your letter C. Okay, five mothers who had their prenatal checkup have pale conjunctiva. So the answer would be your ferrous sulfate. Nakuha. So that's what they call your ferrous sulfate. 85. To prevent backache, anong gagawin natin? Pelvic rock. Okay? So you can give now your pelvic rock exercise. Nakuha. Next, ferrous sulfate of pregnant women must be taken with vitamin C. Okay. Vitamin C. Kailan mas mataas yung absorption niyan? Okay, empty stomach or full stomach? Empty po siya. Okay? So mas mabilis ang absorption kapag empty. Kaya lang, ang nagiging problem, nagkakaroon ka ng gastric upset. So therefore, to get rid of gastric upset, anong kailangan mo? Take it with full meals. Okay? So mahapdi yung tiyan. Okay, so ganon. So next po, if the mother received her TT4 vaccine, this will give her protection up to how many years? 0, 3, 5, 10 years. Okay, so we have your 10 years. Nakuha po ba? So 10 years po. The nutritional status of women prior to and during the pregnancy plays a key role in fetal growth and development. Among which of the following is essential to promote fetal brain and development? Ano ang kailangan mo for fetal brain and development? And spinal cord. So what's your answer? It's your folic acid. Okay, so what's our keyword? Is nandito po, spinal cord development. Nakuha. Okay, the mother is on her first prenatal checkup and the midwife injects her tetanus toxin immunization. So, TT1 will give the mother how many years of protection? 0. Okay? 0. Hindi lang po sa OB lumalabas ang inyong tetanus toxoid. Mas madaming siyang lumalabas into your PHC. Okay? High maternal deaths in developing countries are recognized in public. Okay? So what is your answer? The answer is 2015. Okay? Pero hindi naman siya na-reach. So nga. A tool used when rendering prenatal care as a guide in identification of high-risk factors. What's your answer? It's your HBMR. Home-based mother's record. Again, kapag danger signs of pregnancy, saan siya? Danger signs of pregnancy, what panel? Panel 1, panel 2, panel 3, or panel 4? Panel 2. Referral. Panel 3. Postpartum. Panel 4. Tetanus toxin immunization. Panel 1. Okay, so panel 1, 92. All women giving birth and their newborn babies should be protected against tetanus. So the purpose of giving the vaccine of women of childbearing age and to pregnant women is to prevent tetanus and to protect their newborn infants from neonatal tetanus. Maria is 32 weeks pregnant woman. She is on her first prenatal visit since it's her second pregnancy. What does tetanus toxoid will receive? Okay. She on her first prenatal visit since this is her second pregnancy. So ano? So therefore, ano yung susunod is we have your TT3. Nakuha po ba? Okay, TT3. Okay, but you know what? Ang nagiging problem po natin is as much as possible, okay, at least nagbibigay tayo pag pregnancy ng ilan. Okay? For pregnancy, mga bebe, for pregnancy is at least 2 doses. Okay? At least 2 doses. Okay? So at least 2 doses po siya. So that was based now on your target setting kasi. Okay? So since this is her second pregnancy, pwede ka nang magbigay. But then, ibabalidate kung maigi to ha. Okay? Kasi ang pinaka-the best na sagot dito, of course, would be your TT3. Okay? Si TT3. Kaya lang mga midwives, okay, incomplete kasi yung data, hindi kasi nakalagay kung ilan yung nabigay sa kanya. Okay? So, 93. 93. Which of the following decreases mortality in children with measles is vitamin A? Okay? So, we have your vitamin A. Nakuha po ba? Is we have your vitamin A. Ayan. Okay? So we have your vitamin A. Bakit vitamin A mga bebe? Again, kapag sinasabi natin na vitamin A, ano siya? It improves now your mucous membrane. Nakuha po ba? Okay, so take note ha. Kaya nga, nagbibigay tayo, ano ba yung affected when it comes to your measles? And your measles, it affects now your mucous membrane. Okay, kapag affected po yung inyong mucous membrane into your mouth, it may lead now into mouth ulcer. So kapag nagkaroon ng mouth ulcer, anong bibigay natin mga midwives? Magbibigay tayo ng ano? May mouth ulcer siya. Anong ibibigay natin? Sagot! Okay, so we have your anong ibibigay natin? Gentian violet. Okay, so we have your gentian violet. Okay, gentian violet yung ibibigay po natin. So again ha, on your measles, it affects your mucous membrane. That is why if you have measles, we give now your vitamin A. But then, yung kwan dapat is we have your at least. Okay, gentian violet ha, gentian violet. Number 94. The midwife performs cord care to the newborn and among which of the following needs further assessment? Alin dyan yung kailangan mo ng assessment? 3 blood vessels, 1 vein and 2 arteries. Tama ba yan? Yes. Absence of foul discharges in the cord. Tama ba yan? Yes. Presence of 1 vein and 1 artery? Hindi. Absence of redness and moist in the cord. So the answer is letter C. Okay? So the answer is letter C. Okay? So letter C po. Nakuha po ba? Okay, supposedly, kailangan aba po yan, 2 arteries and 1 vein, but then we have also 1 vein and 1 artery. Okay, so next, 95. A solution used to clean an infected umbilical cord is what? Ano yung solution na binibigay po natin? Okay, so nagbibigay tayo ng alcohol. Bakit kailangan mo ng isopropyl alcohol mga bebe? Para mas mabilis yung pag-dry niya. Okay, so nagets yun na po. Okay, meron siyang redness, tapos nagkakaroon siya ng moistness into the cord. Ano yung pwede namang ibigay? Gentian violet? Ang gentian violet or betadine? Betadine or gentian violet? Oh, what is your answer? So the answer is we have your the answer is we have your yan. So anong sagot? Okay, so ayan. So we have also here kasi on your gentian violet that could use now for less than 2 months of age kasi, for less than 2 months of age, ang ginagamit din natin na panglinis po diyan would be what? Okay? So pwede po ang gentian violet. But then I will validate this I-validate ko lamang po to. Okay? So 95. Okay, 96. A boy is 20 months old. He has 5 days. Cough for 3 days. Is able to drink and doesn't have convulsion and is not lethargic or unconscious. His breathing is 51. So that's considered. Okay. There is no chest in drawing or stridor or wheeze. The boy doesn't have diarrhea but has general rise and runny nose. There is no clouding of the cornea. So ano yung meron sa kanya? O, ano yung mga abnormalities? Cough for 3 days. Okay? He is able to drink, doesn't have convulsion, is not lethargic or unconscious. His breathing rate is 51. So, there's no clouding of the cornea. Ano lang yung meron sa kanya? No pneumonia, cough and colds only. Okay? No pneumonia, cough and colds only. Next, 97. Which of the following? Ay, ang dami pala. Okay. 100 ano to? 142 items ba yung chinek ninyo? Yes or no? Yung in-exam po ninyo? Hanggang 100 lang. Okay, very good. Okay, anong number na tayo? Ayan. Which of the following statement describes the proper care of the cord after delivery? So what's your answer? A, B, C, or D? Okay. So what's your answer? Letter D is the correct answer. Okay, letter D po. Okay, pakisulat po ha. 2 cm or 1 inch above the base. I repeat, 2 cm or 1 inch above the base. Nakuha. Okay? Kapag walang cm, kasi tinanong sa board exam, how many inches? O yan, inch. Nakuha po ba? Okay, so what's your answer? A, B, C, or D? Letter D is the correct answer. How about the second clamp? Pakisulat po and paki-encircle. The second clamp is 5 cm. The second clamp is 5 cm or that's equivalent to 2 inches. Okay, 2 inches. 98. Women, okay, so 5 cm above the base or that's equivalent to 2. Okay, 2, 2, 2. Okay, so next, number 98. Number 98, okay? Okay. Wait lang Balikan ko. Which of the following statement describes the proper care for the cord after delivery? The cord is clamped and cut 1 inch from the baby's abdomen. Okay? Baby's abdomen, mga bes. Okay? So, next, the clamps are removed after the cord has been cut. The cord is clamped but is not cut or 2 cm from the infant's abdomen. Okay, so if you try to look at, tama. Okay, thank you for correcting me into this one. We have two possible answers. Okay. Okay, mali. So the best answer, I'm so sorry. I would like to correct this. Okay, thank you for correcting me into this one. Okay, so the answer is letter A. Why? Because the cord is appropriately clamped and then cut approximately 2 cm, so meaning 2 cm lang, okay, from the infant's abdomen. Okay? Pareho sila eh. Wait lang. Okay. Okay, so we have two answers for number 97. Okay? So, ayan. So the answer is we have letter A and letter C. Okay? Letter A and letter C. Okay, so clamp and cut 1 inch from the baby's abdomen, or the cord is appropriately clamped and then cut approximately 2 cm from the infant's abdomen. So pareho sila. Because in the board exam, they did ask kung ilang inch. So that's why they answered yan, 1 inch. Okay? But now, napansin ko dito, so the answer talaga is Sir A and D po. Okay? A and D. Nakuha po ba? Okay? So balikan nga natin to. Okay, so he is able to drink, doesn't have convulsion, not lethargic, unconscious. Okay? So his breathing is 51 breaths per minute. There's no chest drawing, stridor, or wheeze. The boy doesn't have diarrhea but has generalized rash and a runny nose. Okay? Okay, so we have generalized rash and runny nose. Meron siyang generalized rash and runny nose. There is no clouding of the cornea. Okay, so wala daw clouding of your cornea. So what is your answer? Okay, going back into your measles, mga bebe. Okay, so into your measles, meron tayo yung tinatawag natin na complex spots. Nakuha po ba? Meron tayo yung tinatawag natin na complex spots. Okay, we're in, nasaan ang complex spots natin? Complex spot can be found into where? Oh, saan? Into your buccal area. Okay, so nasa buccal area po yan. Nakuha po ba? So, question mga bebe? Okay, so we have here for generalized rash. Balikan natin ang generalized rash. Okay. So what will you suspect kapag meron kang generalized rash? Okay. So kailan mo ba masasabi na meron siyang dengue? Ay, may dengue. May measles siya kapag meron siyang complex spots. Okay? So complex spots. So kapag may complex spots ka, ang ibig sabihin yan, meron kang measles. But the problem is, hindi kasi siya properly indicated dito kung meron siyang complex spots or wala. Diba, meron tayong 3 classification for your measles. Okay? So we have your measles. Okay? Yung una is we have your measles. Okay? So measles now or within the last 3 months, that's what they call your measles. So ano nga ba yung mga tinatanong kasi natin when it comes to your measles? Okay? Meron ba siyang mouth ulcer, fast draining from the eye, or clouding of the cornea? Okay? So, what's your answer? A, B, C, or D? Ayan. So medyo nagiging tricky siya just because of the presence now of your generalized rash. Okay? So I will look into this one. Anong number siya? Ito. Okay? So balikan ko siya later mga bebe ha. Babalikan ko siya later. Okay? So mga 1 a.m. na. Number 98. Women from menarche age can use a combined or hormonal contraceptives without restriction. So, kapag without restriction, it's category 1. Category 1. An immediate 2 weeks postpartum breastfeeding mother is not suitable to use, especially those under the medication. What's your answer? What's your answer for number 99? Okay, so we have your category 4, or simply that's your absolute. Okay, 100, the last number. A woman arrives at the outpatient department of the hospital and the midwife measured her fundic height at 29 cm and the woman is at 32 weeks age of gestation. The midwife correctly interprets its condition is what? Okay, 32 weeks na siya. Nakuha. Okay, tapos yung fundic height niya is 29 cm. Again, ano yung gagamitin natin na ruling when it comes to this one? Ha-assess rule ba? Hindi pwede ang ha-assess rule. Bakit? Kasi ha-assess rule is what? Ha-assess rule is we have your crown to rump length. Okay? So, ano ang pwede natin gamitin dito? So, 29 cm na siya. Okay? So, we can utilize now the so-called your McDonald's rule. Okay? So, paano yung McDonald's rule po natin? McDonald's rule is used in assessing now. Okay, try nating triangulate. Okay? So, ano yung McDonald's rule po natin? In your McDonald's rule is you're going to use now your fundic height. Okay, example. Okay, ilang cm siya? Ilang cm? Okay, so ilang cm po siya? It's 29 cm divided by what? Divided by, times 2 divided by 7. Okay, times 2 divided by 7. So what's your answer? Oh, 29. Uy, compute nyo nga mga bebe. Okay, so this will be the formula. O yan. Hindi pwede. Okay, sorry. Okay, that's what we are going to utilize now would be your McDonald's rule. Okay? So paano yung McDonald's rule? Okay, your McDonald's rule is you have to what? Okay, ilang cm siya? 29 or 27? Okay, 29 cm times 2 divided by cm. Divided by 7. Uulitin ko ha. 29 times 2 divided by 7. So what's your answer? 8 months. Nakuha. So, ano siya? 8 months. So, kapag may 8 months siya, it simplifies that meron siyang normal pregnancy. Okay? So, normal pregnancy po siya. Nakuha po ba? Okay? So, ayan. Thank you ha. Okay. Sige, check na natin mga bebe. Stop sharing ko pa. O yan. So, that ends now our ratio. Okay? Sa mga naka-face-to-face ko ha, yung assignment ninyo sa akin, which is you have to check yung mga scores po nila for your PHC. Nakuha po ba? Okay. So, 40 to 44. Okay, ano yung 40 to 44? 40, okay. Sorry. Ito pala yung utang ko, no? Okay, babalikan ko to ha. Utang ko ulit to. Okay? Ayoko magbigay ng wild guess dito eh. Mahirap na. Okay, so babalikan ko itong 40 to 44 po natin. Okay? So 40 to 44 po. Yes, baby ko, you have to go back. I'm having my class. Okay? So 40 to 44. Okay, so 40 to 44. Okay, so before we could start with our lecture na lang bukas, okay, before bukas na lang. Naku ha? Okay, so we have also your number 5 and number 7. Okay, so i-message nyo sa akin ha, number 5 and number 7. Number 5. Oh, madami-dami nga. Okay, kasi hindi pa siya na-correct. Okay, so I'm so sorry ha. Kung hindi kasi sa akin galing to. Okay, so may nag-forward sa amin, okay, na isang respected na individual. So, forward din namin sa inyo. But then, on the second set of your pre-board exam, which will be probably next week na siya. Okay? Kasi we have third sets of your pre-board. Nakuha po ba, mga beshi? Okay, so recap muna tayo mga bebe ha. I'll be giving you 2 minutes para i-recap para i-review ang ating PHC pre-board and then let's do the recap thing. Now na. Okay, so let's have a recap mga bebe. O yan. Recap tayo ha. Recap. Ay, sorry. Sige. 1 minute muna daw. 1 minute daw. Okay, so let's do the recap mga midwives. Okay, so let's do the recap. Again. Okay, makinig mga bebe. Okay, so the first international conference on PHC was held at saan? Okay, so it was held at Alma-Ata. Okay, USSR. Very good. Okay, that was at Alma-Ata, USSR. Okay, so we have your so-called your Alma-Ata, USSR. Okay, ano ulit ang tawag natin? Okay, ano ulit ang tawag natin? If there is collaboration of the government agencies and non-government agencies now to prevent duplication of programs, okay, for the promotion of health. Anong tawag natin dyan? That's what they call your intra or inter. Intersectoral linkages. Hala. Okay, that's what they call your intersectoral linkages. Okay, meron tayong proglutids. Anong ibig sabihin ng proglutids? Okay, your proglutids, that is for your tapeworm. Okay, so meron tayo yung tinatawag natin na tapeworm. Nakuha pa ba? Okay, so we have your tapeworm. Again, mga bebe, what are the 3 most common intestinal parasites in the Philippines? Is we have your HOT. Okay, so we have your HOT. Okay, meron tayo yung HOT, coordination among government and non-government agencies in providing health services to the people. Ano siya? Okay, so we have your intersectoral linkages. Okay, intersectoral linkages. Okay, again, okay, if you give TT into the mother, it will give protection to the baby for how long? Few months. Very good. So we have your few months. Okay, so we have your few months. Okay, so again, how many percentage of protection if you give TT3? TT3 is we have your 95. Okay, the first booster dose. Ano yung first booster dose natin? TT3. Okay, if you completed the 5 doses of your TT, anong tawag natin sa'yo? Okay, fully immunized mother. Hindi siya fully immunized child. Okay, so going back mga bebe, are you going to put on alcohol into the stump? No, bawal na bawal po yan ha. Okay, killing of microorganisms including sorry. If you kill all microorganisms including their spores, anong tawag natin diyan? That's what they call your sterilization. Okay, so we have the so-called your sterilization. Saan natin inilalagay yung ating kidney basin into your OB bag? Nasaan siya? Kidney basin into your OB bag. Nasaan siya? Nasa center. Very good. Okay, what do you call now the last to be placed in the public health bag? Okay, that's what they call your paper lining. Okay, so what do we promote if you give aspirin? Anong promote natin kapag aspirin mga bebe? We are promoting what? Bleeding. Okay, aspirin promotes now your bleeding. Nakuha. MDG, what year ang MDG po natin? 2015. How about your SDG? Very good. Okay, so have your SDG po natin. Okay, again natin mga bebe ha. What do you call now the LISA? Ano yung LISA po natin? When we are referring to your LISA, that's what they call your rabies. Okay, how many doses of your human rabies immunoglobulin? Ilan? Okay, so we have your 4. Nakuha? So kailan yan? It's we have your 03728. So we have 4 doses. 03728. Okay? So again, kapag immunoglobulin, what type of immunity? Immunoglobulin, what type of immunity? Okay, so what type of immunity? Kapag immunoglobulin is we have your artificial passive. Okay, how about kapag immunization? Okay, how about your immunization? Very good. What is the mode of transmission for leprosy? What is the mode of transmission for leprosy, mga midwives? Okay, so ano yung mode of transmission for leprosy? It's not proven. Okay, so the mode of transmission, okay, what is the characteristic lesion for leprosy? Ano yung characteristic lesion po natin for leprosy? Sorry, ang aking anak eh. Magulo ang aking baby loves. Okay. What is the mode of transmission for leprosy? Okay. Prolonged skin-to-skin contact. Okay. So what do you call now the treatment for leprosy? MDT. Okay. How about for your TB? Okay. So your dots. Okay. So we have your so-called your dots. Nakuha. Okay. So ano yung non-infectious type? Non-infectious type of leprosy. Paucibacillary. Very good. So we have your paucibacillary. How about your infectious type? Your multibacillary, specifically your lepromatous. Okay? So take note ha. Early or late? Early or late? Clawing of fingers. Clawing of fingers. Very good. Social preparation phase. Very good. Kailan ka nagkakaroon ng nag-i-start na nagle-leader spotting? You start looking for leaders now. Kailan yan? Entry phase. Okay. Formation of an organization. Ano yan? Formation of an organization. Anong tawag natin? Organizing. Okay. So, take note ha. Site selection. Ano yung site selection natin? Okay. Your pre-entry phase. What's the most important step in COPAR? The most important step is your entry phase. What's the other name? When you leave the community, anong tawag natin? Okay, so when the community shares in responsibility in addressing a problem, anong tawag natin doon? When the community shares in responsibility, anong tawag natin doon? Okay, so have your community participation. Okay. So again. Makinig mga bebe. Okay, so wait lang check ko to. Okay. So okay. So next mga beshi. Okay, so again, tetanus toxoid, how many okay, ilan yung doses ng ating TT? Ang daming mga questions ng TT, no? Okay. So next live vaccines. Ano yung mga live vaccines po natin? We have your BCG, we have also your measles, what else? BOM. Ano ulit yung mga BOM natin? Is we have your BCG, OPB, and we have also your measles. Okay? Okay, so have your OPCG, OPB together with your measles. Nakuha po ba mga best? Okay, so again. Okay? Ayan. Okay, so I want you all to take the post test into the GC that I sent. Ayan. You can start taking it now. Kita? Huwag mo nang mag-leave. Dito lang kayo. Okay, please take the online exam now, mga midwives. Now na. Ala, konti pa lang yung nagte-take. Now na po. Okay, so please take the online exam now. Bilis mga bebe, mag-exam na. Huwag tamad-tamad. Go.